Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I am currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about seasonal affective disorder. In this video, we'll first look at what seasonal affective disorder is. We'll then look at some statistics, risk factors, signs and symptoms, effects, treatment, and lastly, we'll look at some coping strategies. What is seasonal affective disorder? Seasonal affective disorder is a type of depression that is recurrent and related to a change in seasons. It typically occurs in the fall or winter. However, it can also occur in the summer. Seasonal affective disorder tends to start in the fall, worsen in the late fall or early winter, before ending in the spring. The symptoms can last from 4 to 5 months per year. Statistics. In Canada, approximately 2 to 3% of people will experience seasonal affective disorder in their life. Another 15% of Canadians will experience a mild form of seasonal affective disorder. It is believed that this disorder makes up 10% of all cases of depression. This disorder typically begins in young adulthood. Risk factors. Seasonal affective disorder affects more women than men. Studies find that women are 9 times more likely to develop this disorder than men. Young people are also more likely to develop seasonal affective disorder as the risk reduces with age. People have a higher risk of developing seasonal affective disorder if they have another mood disorder, including bipolar disorder or major depressive disorder, have a family history of seasonal affective disorder or other forms of depression or mental health conditions such as schizophrenia, live far north or south of the equator due to less sunlight during wintertime, and live in cloudy places. Scientists do not know exactly what causes seasonal affective disorder. A lack of sunlight can trigger the condition. The theories propose that light can shift one's biological clock. A biological clock regulates mood, hormones, and sleep. Thus, a shift can make it hard for a person to adjust to their daily schedule, lead to a chemical imbalance in the brain. People at risk for seasonal affective disorder may have less serotonin activity. Serotonin is a hormone that affects mood, sleep, and appetite. It is also regulated by the sun. Therefore, a lack of sunlight can lower serotonin levels and lead to depression. Lead to a vitamin D deficiency. Vitamin D helps to promote serotonin levels. As sunlight helps to produce vitamin D, less sunlight can lead to less vitamin D, hinder serotonin activities, and thus decrease mood. Increase melatonin. Melatonin is a hormone that affects sleep and mood. Less sunlight can lead to an overproduction of melatonin. As a result, melatonin can increase sleepiness. Signs and symptoms. The major symptoms of seasonal affective disorder is sadness and a despairing mood that occurs most days and lasts throughout most of the day, is present for more than 2 weeks, hinders performance at work or school, hinders social relationships. Other symptoms include anxiety, weight gain, excessive fatigue and low energy, feelings of hopelessness, feelings of worthlessness, difficulty concentrating, agitation, heavy feeling limbs, loss of interest in pleasurable activities, and sleeping issues such as insomnia or hypersomnia. Effects. Similar to other forms of depression, seasonal affective disorder can worsen if untreated. Seasonal affective disorder can lead to suicidal ideation or suicide, social withdrawal, substance abuse, and school or work issues. Treatment. People who have been diagnosed with seasonal affective disorder may need a combination of the following. Light therapy. Since the 1980s, light therapy has been an integral treatment for seasonal affective disorder. The aim of light therapy is to expose those with this disorder to light every day to make up for the reduced sunlight in darker months. Light therapy involves sitting in front of a bright light box daily for around 30 to 45 minutes, typically in the morning from fall to spring. The intense light produces a chemical change in the brain to improve mood and reduce seasonal affective disorder symptoms. 60 to 80% of people with seasonal affective disorder experience relief from the use of light therapy. Light therapy should be used after consulting with a doctor, as there can be side effects. Psychotherapy, cognitive behavioral therapy, is a form of psychotherapy that can help a person with seasonal affective disorder learn skills to change their views of themselves and their circumstances by breaking negative patterns of thoughts and actions that can prolong depression. Cognitive behavioral therapy can help a person replace their negative thoughts related to winter with positive ones instead. This therapy can involve behavioral activation to help people identify and schedule pleasurable indoor and outdoor activities to make up for the loss of interest usually experienced during the winter. Antidepressants. Antidepressant medication may be prescribed. Such medications can include selective serotonin reuptake inhibitors, which regulate serotonin levels to improve mood. And lastly, outdoor activities. Spending time outdoors in sunlight can improve one's symptoms, as well as increasing the amount of sunlight in one's home. Coping strategies. Some strategies to cope with seasonal affective disorder include exercising regularly. Exercise can help relieve anxiety and stress. Spending more time outdoors even if it's cloudy, as daylight can boost mood. Using a light box when fall begins. Eating a healthy, well-balanced diet, as enough vitamins and minerals can supply one with energy. Spend time with family members or friends who can provide support during wintertime. Maximize sunlight exposure indoors, such as keeping the curtains open during daytime. Getting adequate sleep. Managing stress. Engaging in enjoyable activities. And speaking to a mental health professional. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.